Hi, my name is Bob Heavey, and this is Mike Walton. We're orthopedic technicians here at Lowell General Hospital. First, I would like to demonstrate the types of material that we use here. Over on this side, we have the Orthoglass Splinting roll material. It comes in 5 different sizes. You'll need to determine which size to use, which we will talk about in a minute. In addition to that, we'll also need several other pieces of material. You will need scissors in order to cut the roll. You're going to need a towel in order to dry off the roll after immersing, ace bandages, and in some cases, the cotton Weberl padding. This is going to be a demonstration of the 3-inch material, which is going to be common to all sizes. The box opens at the bottom. When you first open a box, you will see a sealed foil packet. In the top of the box, there will be a clip. After cutting off the material you want, the moisture in the air may harden up the rest of the roll, so you always want to make sure that you clip the material whenever you cut it. Right now I'm going to cut off a section of material and show you its construction. Again, every time that I cut this in the demonstrations, the next thing I'm going to do is I'm going to take the material, push it up a little bit inside the foil packet. I'm going to take the clip and clip it back down. The material itself is a fiberglass material with a polyurethane resin. It is water activated, which includes the moisture in the air. It's surrounded by polyester padding material, which is quick drying. When you cut the material, you can see on the ends they're a little bit jagged. You always want to make sure that you trim out this end so this is not against the patient. These become very sharp and dangerous to a patient if it's not trimmed. A good ½ inch usually does it. Now remember, when you're measuring it for a patient, which we'll cover in a little bit, that you should over measure. You'll be cutting off a ½ inch on both sides. You can always cut the material down some more, so it always pays to over measure. We'll talk about that in a little bit. These are the ends of what the cut off of the splint before it was put on the patient. They're very sharp. When disposing of these, they should be put in a sharps container. The fiberglass material inside the splint roll can be sticky. The polyurethane resin may end up on your fingers. You certainly can wear gloves, but if you do get some on your fingers, nail polish removal will easily take it off. The padding material in the splint should be adequate in order to avoid any pressure on the skin. Some providers like to put a little extra padding on. That would be the Weberl cotton padding. The disadvantage of this is that it is cotton. When you wet the splint roll and put it on the arm, the water may go into the cotton padding. Being cotton, it does not dry out very fast. The issue could be that they could be uncomfortable because it stays wet for a long period of time, till if it's very wet, to getting skin maceration. There is one time when we put the cotton padding on, which I'll be demonstrating, it's with the Ulnar splint. That will be later. If you do put on the cotton padding because you need to put it on a bony prominence that sticks out, it just rolls around and tears easily. Some people will put stockinette. This is a polyester material. This does have a tendency to shed water. The question would be is why you would like to use it. Again, it does not offer much as far as padding goes, but it does give you another layer underneath. Made a little thumb hole. Put that on before the splint. I'm going to demonstrate how to roll on an ace bandage. One of the common complications that we see when a splint is applied is the ace bandages are put on too tight. When you put the ace on, you want it to unroll on the arm like this. Some people put it on like this and then they have to pull it away from the skin. Again, it should just naturally unroll as you put it on. The old rule of thumb is that you start distal and work your way proximal. However, most people I know will find it easy just to find an anchor point and then go distal. Notice how much tension I'm putting on here. Not that much. Avoid doing that, especially in one area which could act like a tourniquet. Sometimes when people have a hard time getting around a certain area like a thumb, in order to make it work right, they pull it tight. This is a common problem and you should try to avoid it. When securing the end of the ACE bandage, the newer ACE bandages have Velcro which will attach. Regardless of that or the clips, you should always put a piece of tape on the end. It just double secures the ACE bandage in place. It also gives the idea to the patient, or anybody dealing with a patient, that this is taped on and should not be removed and should not be played with. In order to keep the ACE from rolling up when people take their clothes on and off, you can take tape and put it lengthwise. Try to avoid putting tape all the way around an extremity. This can have a tourniquet effect. If the extremity were to swell, it would swell, the ACE bandage would allow it to swell here and here, but this would stay constricted, resulting in injury to the patient. One good thing that the Wearable is good for is using it as a measuring tape when you need to cut off material to have an amount that is adequate for the splint you want to apply. Say I want to put a splint on that's long. I can tear this off. Because I'll be trimming the edges off, I can add a little bit to this and use it as a measure against the splinting material when I cut it. An alternate method to measuring an arm is to use your own arm in order to measure. I can take Mike's arm. This is a little longer than mine. I can say if I want to put a splint on, I just go to the material, use my arm as a measuring stick, and measure just a little bit longer to get the adequate length. Before putting the splint on, make sure that you are completely ready. Once the splint is wet, you're on a timer. Whether you get it on or not, the splint will dry up within a certain period of time. You should have the patient in a good position. If you can't get them in a good position, you should have someone help you to maintain it. You should have your ACE bandages ready. You should have your splint ready. You should have your tape. If the patient has on any jewelry or rings on the upper extremity, that should be removed ahead of time. If it's on the lower extremity, you should make sure that the pants can come off or go back on. If not, paper shorts should be put on the patient. If you need help holding, you should anticipate this ahead of time. Right now we're going to wet the material. We're going to cut the material. We're going to wet it and apply it. This is just a generic splint. We'll talk about specific splints later. Can't stress enough that after cutting the material, you should put the clip back on right away. Once you take this roll out of the foil wrapper, make sure you trim a ½ inch off of each end, which provides nice padding on one end, and then we'll do the other. Up until this point, the material will not harden in your hands. Once I put it in the water, then again you're on a timer and have to move quickly. You can run it under a sink. You do not have to immerse it all the way. For this demonstration, we have a bucket of water, but I will barely wet it. I have my ACE ready. My patient is in position. The tape is ready. I am not going to be using any of the cotton padding. Gloves in case I need it. All right, we're ready to wet. Only one side got wetted. Take the splint roll once you've wet it and roll it up in the towel. This not only removes the excess water, but also distributes the water throughout the whole splint so there will be adequate drying. Again, the ace bandage rolls around the arm. Notice my movements are deliberate. I don't stop to wonder what I'm going to do next. I have that all figured out ahead of time. Again, this splint will dry whether you get it on or not. This has the Velcro on the ace bandage, so it sticks itself. We never rely on that alone. Put a piece of tape on it. I will put tape down both ends. This was the splint that was just applied. Taking it off. It's hard and will provide stability. It is important to assess the patient beforehand as far as circulation and sensation goes. It is also important to assess it afterward to make sure that the splint did not cause any damage. In Cerner, there is a specific note section for putting splints on that will guide you through all the steps into assessing the patient both before the splint and post-splinting. This is a sugar Tong splint. It is designed to hold fractures of the wrist, sometimes of the forearm. It is inadequate to use on fractures of the elbow. It starts at the back of the knuckles, goes around the arm, and ends up at the palmar crease. You should be able to move the fingers freely once this is on. It will keep the wrist from bending up and down, twisting over, and going back and forth. To achieve preventing twisting, the splint goes around the back of the elbow so that it will catch and the arm will not turn over. Because it goes around the back of the elbow, we want to try to keep the patient from extending their elbow while they're in the splint. So it's always a good idea to give the patient a sling. If the patient were to extend their arm, the splint would either dig into the back of the elbow or it may push itself right off of the arm, depending how it was applied. To apply the sugar Tong splint, you first must assess what size splint roll you'll be using. Either use a 3-inch or a 4-inch. If you're unsure of the diameter, then always use a 3-inch. As we talked about before, we're going to be using the web roll as a measuring tape in order to say how much material we should be cutting off. The splint is going to be going from the knuckles to the palmar crease, so the fingers can make a fist, but we'll go as far as we can without impinging on the fingers on the back side. Again, we'll be cutting off a little bit of material, so let's add another inch to that. Just in case we get something wrong, let's add another inch to that too, just so we have a little bit extra to play with. If you put on a splint that's too short, you have to throw it away. You cannot make it work. If you put on a splint that is too long, you can make it work. We'll show you how to do that. So it's always best to cut a little bit extra material. We're going to go over to the splint material. For Mike, we're going to be using 3-inch. I usually make a little nick in the material so that I don't have to hold everything up and try to measure it for where the nick is. I've already assessed that I don't need help in holding Mike's wrist in position. I have all my materials, which I'll show you in a minute, on the table. All right, Mike is in position. I've already assessed him ahead of time. I have with me a 2-inch ace bandage, a 3, and a 4. I may not need all of these, but again, once this one is wet, you're on a timer, so it's better to have too much material than not enough. I also have the tape ready. Okay, do a little bit of a timeout. I have the right extremity. I know exactly how the splint's supposed to be applied. I have the splint ready, the aces, and the tape ready to go. Okay. The split may be too long, so let's put one end of it exactly where it should be, so only one end is a little bit too long. In this case, what we're going to do is we're going to go by the palm side and put it so that the fingers will be able to bend at the palmar crease. We'll go around the back. This is too long, but we'll be demonstrating how to take care of that in a minute. Mike is able to hold this because it's sometimes hard for someone who doesn't put on a splint a lot to be able to hold it and wrap at the same time. I take the 2-inch ace bandage and start at the wrist area. I'm just pushing it around. One thing to be aware of is when you lift up the arm is that the splint did not sag down, that it's still tight here. At this point would be the time when you would pull it up a little bit in order to make it cinched up on the arm. Your movement should be very deliberate. Take an ace bandage and trying to decide what to do, this is not the time to do it. Notice I just figurated around the elbow. You can see this is not going to fit exactly right. Now what I do is I take this and just push it in a little bit. I sort of organize the wrinkles, so to speak, and not make it so tight that anything will press onto the skin. Remember not to pull the ace too tight. What I'm going to do is take my scissors, fold the ace back a little bit. I'm going to go, I want the splint to the knuckle. Before it dries too much, I'm going to cut the splint. I'm not going to fold back that edge and cut it and trim it down like we did taking off out of the box. Instead, I'm just going to roll it over a little bit like this and use the ace bandage to hold that rolled over. By doing that, there'll be a nice padded edge. On the palm area, if I went a little bit too far, I can take and roll that down a little bit too so that the palm fingers move all the way, the thumb is free to move, the wrist is in a good position. I'll add the tape. make sure you have something soft to rest the splint down on after you put it on. If you were to put this on the table or an edge, that would dry that way and would actually become a pressure point and may harm the patient. This is a thumb spica splint. It's used for fractures of the thumb. It can also be used for fractures of the wrist, specifically the scaphoid bone, which is located here. It can be used for fractures maybe in the distal radius. It depends on the provider giving the order for it. It extends from the thumb tip up far enough the arm so that the patient can bend their elbow without it digging in. It's imperative to try to keep the position of the wrist not like this, but straight. The only reason you would not move it into that position is if doing so creates a lot of pain for the patient. For the thumb spica splint, we will always use 3-inch. The reason is that when the splint goes across the thumb and reaches this area, it has a little bit of a concave area. The wider the splint you use, the more it may buckle and create pressure in this area where there is a nerve right here that could be affected. When we measure, we're going to measure from the thumb tip all the way up to the bend of the elbow. All right, when you put the splint on, you're going to ask the patient to hold his thumb up. Sometimes it's too painful to do that, so the patient compensates by turning their wrist down like this. With some fractures in the wrist, this actually pulls the pieces apart. So you would try to keep the wrist as much in a neutral position and not droop down as you can. If you cause extreme pain by doing this, then leave it the way it is. Pain is usually an indicator that you should not be moving something into a certain position. I'm going to lay the splint across the arm and see where I am. This is going to be a little long. In this particular case, instead of trimming the splint, as I did with the sugar tong, I'm going to be folding it over, which is a quicker way of dealing with it. I have the patient in position, fingers out straight, thumb up. I don't need anybody to help me. Rings and jewelry have been removed. I have two 2-inch ace bandages. I'm going to remove the clips. I need a towel. I have a tape. Ready to go. Now, I mentioned before about putting aces too tight. When you wrap the thumb, you can put a little bit more pressure on the thumb than you would the rest of the extremity. So before where I said you would put this much pressure, you can make it a little tighter, but only on the thumb. Notice I'm kneading the splint a little bit. I don't want to create pressure on that little nerve that's at the base of the thumb. I'm going to go a little slowly so you can observe the technique I have for securing the thumb in place. I do a figure 8 around the thumb. I'm going to come up on the back of the hand, come through here, and I can twist Mike into a pretzel. Come here, everything is covered. I use two 2-inch aces for this. If you're not sure, if you don't, of your technique, instead of a 2-inch for the second roll, you can use a 3. It will cover more area. Tag that in down. This is an Ulnar splint. It wraps around the last 2 fingers. It goes around the arm as a cup shape or a gutter, hence its name. This is the ideal position for it, with the fingers at the knuckle bent down and the fingers straight. You may not be able to achieve this because of the patient's pain. A variation of this is that 3 fingers could be included, but that would be up to the provider in order to tell you that. The Ulnar splint is a splint that wraps around the last 2 fingers, sometimes the last 3, but it should be specified by the provider if that is what is required. You measure from the tip of the fingers down the arm to about where the elbow bend is. This is the one splint where we would use some cotton padding. You can put it between the last 2 fingers to keep it from chafing or collecting moisture. Always use 4-inch material with this, because we're wrapping around a bigger area. The best position for an Ulnar splint is the intrinsic plus position. The intrinsic plus position is with the knuckles bent as far down as you can and the finger joints straight. Why this is the best position, because the patient is probably suffering from a fracture in this area, you will be unable to get this. Do the best you can. I'm actually going to start with the fingers straight and we'll bend them down. When you put on the splint, remember I said before we're leaving a little bit of padding on the end so that nothing would dig in. Make sure you don't think this is the end of the splint. The end of the splint is actually down a little bit inside. So when we put it on, it looks like it's sticking out a little bit. It really isn't. So we're going to cup over the last 2 fingers. Now, with the thumb Spica splint, we were able to wrap the thumb tight. Do not wrap these last 2 fingers tight. You will probably cross the fingers over, and that is not acceptable. I'm going to go slowly so you can see my technique. I come down so that everything is covered. Don't be afraid to move a little bit to make sure that everything looks like it's okay. I used two 2-inch aces here. I was able to complete the splint, but I do a lot of these splints. You may want to have another 2-inch ace ready just in case, or use a 3-inch instead of the second 2-inch. I want to go for the intrinsic plus position. To do that, the best way to do it is to grab in here. Now, the bend for the little finger is not here. The bend for the little finger is way down in this area here. So I want to grab here in order to stabilize. I'm grabbing way down. I'm going to go on this controls the hand and the wrist. And take my hand here and just press the hand down, press the fingers down so that they're straight and hold it in this position. Be careful if you're grabbing here that you don't grab the little wrist bone that sticks out on the other side, the ulnar styleway. That could create a pressure problem. So I'm really just grabbing with these two fingers to stabilize it. I'm not grabbing the whole hand and wrist. I'm going to demonstrate how a long arm splint is applied. This splint is used for forearm injuries, elbow and upper extremity injuries. When you're measuring for the splint, make sure you make it long enough. I would much rather have this too long than too short. Having a splint too short is a common problem that we see. The splint goes in the hand in a gutter position, but enough so that the fingers will wiggle. It extends up to the armpit area. If you have a fracture right here and you make the splint only to this area, you're not securing it very much. You really need to have the splint all the way up to the axilla. For ace bandages, you need 1, 2, 1, 3, and 1, 4. Start distally. As you go around the elbow, you're going to create wrinkles. We do what's called dog ears. We actually pinch the material and fold it over and catch it with an ace bandage. Do the same on the other side. Pinch it, fold it over, and then catch it. Obviously, don't pull the ace too tight. You never should anyway, but in this particular case, those little wrinkles could become pressure areas. When you put it down, make sure there's a soft surface so you don't create any pressure. The best position is a neutral position for the forearm. We don't want the arm turned over or turned up. It's also as best as at 90 degrees. Now, having said that, if you try to position the patient at 90 degrees and the patient cannot because of pain, do not force the arm into that position. You should always have a sling ready to put on after you put this on. The best way to keep this in the 90-degree position is to let it rest in a sling. Let the strap hold the sling that will maintain the elbow at 90 degrees. It's important to look for circulation with these types of splints. You should always assess the 3 nerves that innervate into the hand. 3 things you should do. One is give a thumbs up. The other is give an okay sign. And the other one is to make a wish. Those are the 3 major nerves that innervate. If they can do that and they have feeling to the fingers, then you should be okay, and you should document it as such. A coaptation splint is used for fractures of the humerus. This is a fairly difficult splint to apply. Unless you've had some practice doing it, you may want to ask for some help from the practitioner, or ask for somebody who may have had experience doing it. You definitely need another person in order to hold the arm. A fracture of the humerus is usually pretty flail, and the arm will be moving around. The splint is actually two splints. We're going to put an initial splint at the top, which resembles the sugar tong splint we put on the wrist. We start it in the axilla, and we come over the top of the elbow.
Yeah.
Always use 4-inch. Take 4-inch aces. Wrap as high as I can. Just as I did with the sugar tong splint, I'm going to create little wrinkles around the back of the elbow. Just kind of hold them in, but not pull them so tight that they'll create a pressure area. I was able to use two 4-inch aces. You may want to have another ace available in case, because you're not used to putting the splint on, you need a little bit more. This is the first splint. You allow this to make sure this is dry. You put a second splint on. A long arm splint. You're now wrapping one splint on top of another. Be careful the amount of pressure that you put on as you do it. That is coaptation splint. We're going to talk about applying a short leg splint, also what's called an AO splint, or a short leg splint with a sugar tong overlay. For this we're going to use a 4-inch for the main splint material, and then for the U splint we're going to use a 3-inch. You notice I have 3 4-inch aces and a 6-inch ace out. I always start with a short leg splint first. This type of splint is usually used for unstable ankle fractures. Most non-displaced or minimally displaced fractures of the foot and ankle will go in walking boots, but you will have occasion where you'll have to put on one of these splints. Don't try to hold the splint up. A 90-degree position is best to put the ankle in, but for these types of injuries, it may be very difficult to achieve. As we did with the long arm splint, we're going to make a couple little dog ear folds. You want to make sure that the splint in the back doesn't go so high that it will dig in when the person bends their knee. In this case, I'm going to roll the splint down. If you can locate the tibiotubercle, which is the bone just below the kneecap, the splint should end just about an inch below that. Once we get this splint on, we're going to put the sugar tongue over. This provides twisting stability to the ankle. Remember, when you're putting one splint on top of the other, be very light with the touch of the second splint. Very easy to make these two tight. And just secure it. There'll be times we're putting the splint on where the leg over the bed is not possible. In this case, we're going to lie down. You may need to have somebody hold the leg up in the air when you put the splint on. When you're done, put a pillow underneath the leg to secure. One important thing to remember is that you don't want to put excess pressure on the back of the heel for breakdown. When you put a pillow on, you want it to end before the heel. When checking for circulation and function, you should see if the big toe will move upward. Downward does not count. Also, if they have sensation on the toes. The perineal nerve is a nerve that runs just below the knee on the outside, is very superficial by the fibula neck area. You want to make sure that the splint is not pressing on that area or the ace bandage isn't. The function of the perineal nerve is dorsiflexion of the ankle and the toes.